It's a lot of pain people experience from rheumatoid arthritis, and it's a disabling disease. First thing is that we must distinguish rheumatoid arthritis from the regular arthritis. Regular arthritis, people have joint pains, knee pain, back pain, shoulder pain for different reasons. Wear and tear, people have a bad posture, obesity, and sports injuries, workplace injuries. Those culminate into general regular osteoarthritis. But rheumatoid arthritis is quite different. Rheumatoid arthritis actually is an autoimmune disease. Autoimmune means that the body develops antibody against body's own substances. So there's a factor called rheumatoid factor, which is an immunological marker that is present most of the time in people with rheumatoid arthritis. So we also call it seropositive arthritis. And rheumatoid arthritis usually is symmetrical, which means that it occurs in both sides of the body. Commonest sites are the hands, fingers. It can occur other places too, as well as in the knee or the back, the shoulder, any place it can happen. So rheumatoid arthritis, it's a called synovitis. Synovitis means that any joint, inside the joint, there is a synovial membrane. Synovial membrane, inside there is a little fluid there. And so the joints can move. It's like same mechanism as a ball bearing that we see in auto parts and stuff like that. So joints move because of the synovial membrane and the fluid inside the joint. The synovial membranes get inflamed. We call it synovitis. At that time, when the initial synovitis, you can see the joints get swollen, the red, tender, and they have impaired function of the joint. The joints can't move. So if it continues, it can cause some erosion of the joints, which means the joints get damaged. So we do see a lot of things of joint damage in the hands and other places of the body. Sometimes there are deformities that happen, and sometimes they have to be surgically corrected if not, if getting too much of damage to the joint. Rheumatoid arthritis does not have any treatment, and what we have is management of the symptoms and prevention of the damage to the disease. Prevention of rheumatoid arthritis is nothing we can do because somebody have it, will have it. However, we can manage the progression of the disease by doing light exercises to the joints affected, and heat. Application of the heat can help symptom control. Non-steroidal anti-inflammatory medications like Advil, Motrin, they help. Sometimes prednisone, and management of the long-term control of the disease. There are certain things that comes up along with rheumatoid arthritis. People can have fatigue, tiredness, and sometimes people can have anemia. We call it anemia of chronic disease. So if that happens, other causes of anemia need to be ruled out, whether there is any bleeding or not, but this is managed by monitoring closely and sometimes some medications that can be given to improve the symptoms of anemia as well as improve the hemoglobin. Rheumatoid arthritis can be hereditary. Any autoimmune disease, some people have other autoimmune disease in the family and they have rheumatoid arthritis. So that's also part of autoimmune diseases are hereditary.